So good morning, everybody, and thank you for coming. Again, I do want to thank all the first responders like I do every day. Can't make stuff happen without the hospitals being opened up and everyone keeping essential services moving. Thank you, thank you, thank you. But, you know, you got to keep things moving in the right direction. And, you know, unfortunately, last night we had 4 people pass away. So our total now is 20. We had 2 males, 87 and 67, female 62 and 76 that passed away last night with underlying, 3 out of the 4 had underlying issues. And my heart goes out to the families, my condolences to the families, to all the families that had to go through this and lose their loved ones. It's a hard time right now. We're at a crossroad in our nation, and you know, this is what's going to define us. And by social distancing, by doing the right things, and changing our habits, and being differently, is going to save lives. And it's going to, you know, help save people that have underlying health issues, or just, and the studies and statistics have showed too, people that don't have underlying health issues have passed away from COVID-19. So, you know, again, my heart goes out to the families, my prayers, and our thoughts are with you at this time of need. And again, unfortunately, we had 4 more pass away last night. So as this morning, we have 515 positive cases of the coronavirus in Albany County, with 663 people being under mandatory quarantine and 71 people under precautionary. As you know, of yesterday, there was 499, so we went up 16 people. And yesterday, there were 676 people under mandatory quarantine. That number's dropped down a little bit, and there were 77 people under precautionary, which we dropped down to 71. We still have 29 people in the hospital with a hospitalization rate that has dropped down 5.6, and 12 adults in the ICU. Again, it's working. It hasn't gone away. Our numbers are steadily staying the same, hospitalization rates and all that, but our death rate continues to go up. So it doesn't mean it's all clear and things open up today. I just want to keep reminding people about social distancing and everything else that we need to do in self-isolation to continue that practice. Please, please. But we also needed new testing locations, and it's something that Dr. Whalen and I have talked about, especially when the testing stopped here a couple weeks ago, and then within a partnership with the state of New York, we got Albany up and running, and I can't thank the governor and his people enough for that. But when you're doing mapping and tracing, one of the things we talked about is how do you know about dealing with testing in areas that are listed to the community that are most underserved communities in the county. And how do we address that issue? And how do we look at mapping and tracing when we're not getting the statistics and data that we need? And part of my equity agenda 7 years ago, when I started down this road, was to look at areas that are underserviced, areas that have underlying health issues, areas that just have economic and other things against them that we can make a difference. So we figured it out, and it's taken a while, and I want to thank everyone that's been involved with this. But that's why we've been working so hard to put together a truly mobile testing site in different areas of the community. And I want to thank our DGS department, Dave Latina, our commissioner. I want to thank Sheriff Apple, whose people are going to provide the security for these sites and help with the traffic control and everything. And I want to thank my staff, my deputy, Dan Lynch, my counsel, Chris Quinn, Luke Rogers, and my budget director, Sean Fallon, and everyone else that worked on this, Dr. Whalen and her team, that made this a reality in this announcement today that we're announcing. We're really going to be the first county in the state of New York that's truly going into areas that need to be tested, that have higher underlying health issues and other things that we need to address to make sure we're this COVID-19 is at in this community and how we can address these issues. It's not possible without working together in a partnership. And I can't thank Whitney Young enough for their leadership in the community, and not just on this topic, but Whitney Young being the backbone of that community for a long time, and for their leadership down there. So to the Whitney Young Center, we can't thank you enough. And like I said, for these sites that we're establishing, and again, this is really a big deal that this is getting done. And I can't begin to tell you the sleepless nights and the logistics that went behind this to make this a reality. And I can't thank enough everyone that's been involved. But for these sites, to get an appointment to come to the site, the number is 518-465-4771, 465-4771. You call there, you'll get an appointment to come. And our first testing site is going to be held tomorrow. The first testing site will be held tomorrow at noon, from noon to 4 at the Capitol South Campus Center. 20 Warren Street will be the first site established tomorrow. From noon to 4 at the Capitol South Center will be the first site that people can come to. And the difference with this is going to be walked up. I'm glad that we got Albany up and running. The problem is, how do people get there? So this is going to be where people can get to in the community. They can walk to. And we realized we have to be out through the community. So we're going to be moving the site every other day, or every day. We're working the logistics out. We're going to be doing 4 sites, and we're also going to be doing a site in Watervliet. So we already established all the sites. We're going to be going throughout the community. So if someone in Arbor Hill can't get to Warren Street, someone in Warren Street can't get to Arbor Hill, we're going to be back the following day to make sure that we address them issues. Testing Friday will be at the Whitney Young at 920 Lark Drive in Albany from 9 a.m. to 4. So Friday will be at the Whitney Young Center from 9 a.m. to 4. And testing will be held Friday at Bleecker Terrace Apartments on North Manning Boulevard from 9 a.m. to noon. And the Watervliet Health Center will be opened up at it's 1804 2nd Avenue in Watervliet from 1:30 to 4. And again, all testing is done by appointment. So I do want to say to everyone that has been involved with this, to the mayors of the river community, to Patrick Salary, Mayor McNulty Ryan, Mayor Cahose, thank you to everyone that's been involved to make this a reality. It can't be done without working together. And we're showing that. At a time when we need this, it's come together. I've heard the underlying issues in the community, and I want to thank the Black Caucus. I want to thank Bill Clay, Wanda Willingham, who have brought this issue continuous to me about concerns for their community as a whole. We have listened, and we are going to deliver, and that's the most important part. We are delivering on a promise that I made 7 years ago, have continued to deliver on, but we'll continue to make sure we're addressing these issues as we go forward. But I'm going to ask the President and CEO of Whitney Young, Dave Shippee, to explain how you can get an appointment and what happens when you call, and everything else we need to know about what's going on here, Dave. So thank you.
Okay. Thanks, Dan. So in terms of process, as the county executive articulated, it'll be an appointment-driven process. There'll be a set of screening questions not dissimilar to what one would experience if they were using the SUNY Albany testing site. And then you will be appointed a time at one of the venues depending upon the day and the location that the person is calling from. So this will accommodate obviously not just Whitney Young patients, but folks in the communities that we serve at Whitney Young. And once appointed, then we'll encourage people to show up at that time. And again, because they're not in vehicles, they will be out. The staff will be dealing with patients one-on-one as they come through, and we will be gathering enough demographic and basic screening information that we are assured of having a way to contact people when the results are back. And the goal in using the laboratory, the reference laboratory that we're using is it's a fairly quick turnaround time. It'll be the same laboratory that's doing the testing at the SUNY Albany site. So they're in the region every day picking up specimens and delivering tests. So we think there's a good supply of testing equipment there, which has been a problem, and to this point is just access to the availability of tests, even for our own patients at Whitney Young. So I think that we're looking forward to the ability to get to these neighborhoods, because we know from the work for the last 45 plus years at Whitney Young that given the huge disparities in the populations that we serve and the neighborhoods that we hope to take this to over the next couple of weeks, that there is a high prevalence of chronic conditions there that, as we look at the national data, are leading to a greater death rate amongst people of color. And so we truly hope that this will allow us to identify where that is and allow us to make greater decisions about how we move forward over the next couple of weeks and couple of months with this pandemic. So again, thank you, Dan, for the opportunity, and Liza for the ability to kind of work with all of you. And this has certainly helped us, I think, redefine community. So thank you.
Dave, thank you, and thank you for helping us get more people tested that can't get to you, Albany, that don't have transportation, and that rely on the infrastructure, which that's what we want. We want to be a green community. We want people taking transportation, but we have to address that issue too, and we have done that. So thank you again, Dave, to you and to Whitney Young for being a great partner in this, and to helping us do this great announcement that will help the community. Dr. Whalen, too, thank you to you and your team and your hard work on this topic. But Dr. Whalen.
I just want to congratulate County Executive McCoy on this wonderful partnership, and thank Dave Shippee for collaborating with us on this. I think when we look at what local public health does, and we've talked a lot about this in terms of the pandemic. We conduct contact tracing, investigation of communicable disease, so that we can early identify people that have COVID-19 and make sure we reach out to those contacts and have them appropriately quarantined. Another core function of local public health is really to assess the health of the community, and every 3 years we put out a community health assessment, which helps us identify the neighborhoods that we have in Albany County that we know are particularly high-need neighborhoods, neighborhoods where citizens live that have disparate health outcomes and underlying health conditions. So we can target these neighborhoods. We know that we are responding to COVID by evidence and science, and the first evidence and science that we looked at was availability of testing. We worked hard to ensure that there was testing done in Albany County, and the SUNY site opened up. This has been a great bit of progress in Albany County in enabling us to have more widespread testing. But of course, the first thing that we realized is that it would test individuals that could drive to the area, but there were significant communities that we're concerned about impact that may not have that availability. So we immediately started working on how we could have test equity in Albany County. And as the county executive indicates, there were a lot of discussions on this and a lot of planning and a lot of ideas put forth. And I really think that this idea, and I thank again Dave Shippee for doing it, utilizing the mobile testing, is just a great idea, because it enables us to go to multiple locations and test people in locations that we feel will be easily accessible. This is going to be a process that we look at going forward. If we need to adapt and look at different locations, we can take those things into consideration. But I think it is a phenomenal way of expanding the testing that we have, so that then we can, from that, get the data that people are looking for. Across the nation, we're hearing about disparate outcomes of COVID-19 dependent on race. And I've been asked that question many times. And I've said that the data we have so far is not robust enough to get a good picture of how this is playing out in Albany County. I believe having this additional test site is going to enable us to get better data. It is going to enable us to look at these communities, these high-need communities that we serve every day with our public health programs and services to try to prevent poor outcomes with many chronic diseases. It is going to enable us to get a better look at the community, and we're really thankful to be able to do that, and it makes me proud to be Commissioner of Health in Albany County. So, our staff continues to do the work that we're doing. We talk a lot about hospital surge capacity and say in Albany County we have not reached hospital surge capacity, and this is a good thing. But public health surge capacity, we've been there since day one. So again, I want to commend the county executive for expanding the hours of service of the health department so that we are working 7 days a week to be able to respond to this. Expanding the amount of workers that we have in the department through mobilizing our Medical Reserve Corps, through ensuring that other departments that are in the county employ are coming to aid us, and we appreciate the aid those other departments are providing us. We really have responded to this in a way that I think is commendable and an example for other local health departments, and I want to thank the county executive for all his support on that.
Thank you, Dr. Whalen. I want to thank. I'm glad that you're our health commissioner. So thank you for your leadership and everything that you're doing. I can't thank you enough. I do want to emphasize again. I can't thank the Black Caucus enough. Bill Clay, who's been a leader for years in the community, Wanda Willingham, especially, and President of the Common Council, Corey Ellis, who I've been in numerous conversations with on this topic and other issues, underlining different areas of the city of Albany, and Mayor Sheehan, who we regularly talk to every day. So I can't thank them enough for their leadership, especially the mayor at this time. But again, we have to find what's going on in the underlying communities, what the issues are, and this will help us do it. But who am I to talk about it? So I want to thank, from the bottom of my heart, Dr. Ford taking the time to come here today to talk about this issue, talk about the community and how we can change the way we're reacting to certain areas and how we can better service the community. But Dr. Ford is an intensive care unit and critical care doctor with Schenectady Pulmonary and Critical Care Associations. So she's here to share some things with us in seeing how this treats certain patients. So, Dr. Ford, I'm going to leave it to you.
Thank you, Dan,
Thank you
for having me. Thank you, Dr. Whalen, for also being here. As Mr. McCoy said, that I am a critical care physician. So what we've been seeing on the front lines is we've been seeing a disproportionate amount of African Americans that have been sick but also dying. And one of the reasons, communities and, the nation is looking at is why is there a disproportionate amount of African Americans that are actually dying, not just getting sick from this disease. And it goes back to African Americans being having high risk for diseases such as hypertension, diabetes, renal disease, and obesity, as well as underlying heart disease. And a lot of these issues are sometimes not known in the African American community. People walk around with not knowing that they have high blood pressure or diabetes, and sometimes they do know this, but it's often ignored. The symptoms are ignored, or there's not access to health care. They have no transportation to get to health care. They have no insurance for health care. So this proportion, this group of people are not able to get to, the doctors that they need to see to get these underlying conditions treated. So when something like COVID-19 comes along, this population is hit at an extraordinary rate, such that they don't have the ability, the physical ability, to actually help fight the virus. So we are seeing a lot of patients coming in late, okay, because they don't have an access to get to testing, which thankfully Albany County is now setting up testing in these communities where patients can actually walk to these testing sites. Some patients haven't gotten tested or walk into a hospital and they're turned away because of lack of insurance. So we have to let our African Americans know that, number one, if you're not healthy, you have to stay at home, you have to wear a mask, and you have to limit distance and limit exposure to people, okay? Number two is that underlying issues such as diabetes, hypertension, you have to take care of yourself. Obesity, you have to take care of yourself. You have to take your medication even though you feel fine. You have to see a doctor even though you might not have insurance. There's clinics out there, there's other ways to get the assistance. And even when this coronavirus pandemic is over, this situation as far as African Americans and the health situation is going to continue. And if this is not a wake-up call for the African American community and even other communities to put a light on these issues that minorities face in this, then it's something to move forward to, something to look forward as this pandemic goes over.
Dr. Ford, thank you, and I know they're going to have questions for you. One thing I do want to emphasize through this whole thing, we don't care if you don't have insurance. We don't care if you can't pay. Albany County is paying for it. So we're not looking for any money, so don't worry about how you're going to pay for this. If you're not feeling good, please don't worry about health care. If you have health care, we're going to take it. We're going to charge your health care. But if you don't worry about it. There's no cost to you other than going through the proper procedures to get checked. And that's all that matters at this point in time. So Dr. Ford, thank you. I do want to say a couple of things. I want to share the good news. Our Hilltown communities are helping each other out. Tomorrow there'll be a food drive from 9 to 11 at the First United Methodist Church of Voorheesville at 68 Maple Ave in the upper parking lot of Voorheesville Public Library, 51 School Road, to benefit Voorheesville and New Scotland Food Drive Pantries in St. Matthew's Church, in Burn Food Pantry at Lutheran Church, and the Westerlo Food Pantry at the Reformed Church. So thank you for everything. They're looking for non-perishable foods like soups, pasta, mac and cheese, and everything else that you can donate in personal items like soap, toothpaste, deodorant, shampoo, and so on, baby wipes. So thank you to the Hilltowns community coming together to make this happen. I can't thank you enough. And because Albany County, we do care about everybody, and thank you. And then also our mental health line is still established 7 days a week, 8 a.m. to 8 p.m. The number's up that you can look at. Area code 518-269-6634 and our 211 in New York State hotline. Thank you for all that too. And one of the things I want to remind you, the first testing site tomorrow will be at the Capitol South campus. And then day 2, which will be Friday, the testing site will be at the Whitney Young. And testing will be held Friday at Bleecker Terrace Apartments on North Manning Boulevard, so in the Rivers community. So I just want to make people aware of that, but please go to our website, call the number, we'll make sure it happens. And again, I can't thank everyone enough for your input, for your help in this matter, and the partnerships, because it does take people to come together to make things happen. So thank you for everyone.